According to the Brain Aneurysm Foundation, the annual rate of rupture of an aneurysm is approximately 8 to 10 per 100,000 people, or about 30,000 people in the United States a year. Ruptured brain aneurysms are fatal in about 40% of these cases. Of those who survive, about 66 suffer from permanent neurological damage. With an aneurysm rupturing every 18 minutes in the United States, having an aneurysm poses serious health risks toward people everywhere. Most aneurysms go unnoticed until the damage they have caused has either become irreversible or extremely expensive and unbelievably hard to deal with. The past few months have been difficult for my family, as my mother all of a sudden became extremely ill, complaining of an excruciating headache and nausea. Her eye then became swollen and then started to float on its own. Most of you would refer to its appearance as a lazy eye. She was then taken into the emergency room where a CT scan was taken and nothing was found, and she was later then released. This later would be seen as a misdiagnosis. A couple of days later, she was taken into a University of Nebraska Medical Center facility where she was given appropriate tests and diagnosed with a cerebral aneurysm. Throughout this presentation, I hope to educate and inform about what exactly an aneurysm is, what are its causes and symptoms, and how one may go about treating an aneurysm. So what exactly is an aneurysm? An aneurysm is an occurrence where part of an artery or cardiac chamber swells because a vessel is either damaged or a weakness in the wall of the vessel has arisen. In this weak part of the artery, blood pressure begins to cause the vessel to balloon out at its weakest point. The swelling of the artery can occur slowly or very rapidly and can cause the swelling to be dramatic. When the ballooning is larger, it tends to extend along the blood vessel to make an even larger aneurysm. As the aneurysm becomes increasingly larger, there is a growing risk of it rupturing. This is known as hemorrhaging, which will lead to other health complications and possibly that of sudden death. There are two different types of aneurysms: an aortic aneurysm, where the bulge occurs in the aorta, either in the abdominal region or the thoracic, which is higher up in the torso. Or the aneurysm could be a cerebral ballooning, which occurs in an artery in the brain. How does one know if they have an aneurysm? The symptoms of an aneurysm are connected to the size and severity of the aneurysm. It could be very different in a variety of patients. Smaller aneurysms tend to not cause much that in the way of symptoms and may oftentimes go unnoticed in the patient. Other cases where the aneurysm is larger, such as a cerebral aneurysm, the ballooning may press up against nerve tissues and cause numbing of the face and problems with the eyes. For that of a cerebral aneurysm, many of the symptoms could be seen as just a severe migraine, as what my mom had thought it had been. Symptoms can include nausea, vomiting, eyesight problems, seizures, loss of consciousness, confusion, a drooping eyelid, a stiff neck, and light sensitivity. All of these, or a handful of these symptoms, could occur in the case of a cerebral aneurysm. Again, it depends on the specific case. Many people with aortic aneurysms, especially those with ones in the chest region, may not experience any symptoms until the aneurysm has already become very large. A variety of symptoms with aortic aneurysms can arise, such as a deep throbbing pain, a cold foot if the aneurysm has blocked the blood flow of an artery, and fevers. The symptoms of aortic aneurysms are similar to the symptoms of other problems that cause chest or belly pain, such as an ulcer. With having observed the symptoms of an aneurysm, there are three main ways to diagnose the presence of the weakened vessel wall. The three most used ways to diagnose an aneurysm are through the use of ultrasound, a CT scan, and an MRI. In an ultrasound, mainly used on the abdomen, a patient lies on their back while a warm gel is applied to the skin of their abdomen. The gel is to prevent the presence of air pockets while the transducer is placed on the skin. The transducer is moved along the surface of the abdomen while sending images to a monitor. In a CT scan, X-rays are used to create a three-dimensional picture of the targeted area of the body. Finally, an MRI, known as magnetic resonance imaging, uses magnets and radio waves to produce both 2- and 3-dimensional images of the targeted area. With the images produced by the three different methods of aneurysm detection, A diagnostic radiologist can look over the images and detect the presence of an aneurysm. When a doctor has finally been alerted to the presence of the aneurysm, a series of things can be done to treat the problem. In the case of preventative surgery against the rupturing of an aneurysm, there are usually two choices: watch and wait, or surgery. If the aneurysm is small and not growing very fast, some patients and doctors find it best to let the aneurysm ride and watch how it does, because, as I said before, some patients can go on to live a normal life without ever noticing the aneurysm. If the aneurysm is noticed to be very large and or growing at an alarming rate, it is usually the best route to go for surgery. In the case of an aortic aneurysm, invasive surgery can be used to go in and remove the section of the blood vessel that has been damaged and ballooned out and replace it with a synthetic tube that is sewn into place. The patient will need several months to recover from such a surgery. In a less invasive surgery, a catheter is placed in through an artery until it has reached the site of the aneurysm, in which case a graft, a woven tube covered by metal mesh, is put into place to strengthen the walls of the artery. This surgery allows the patient to recover faster and usually presents fewer complications in the future. In cerebral aneurysms, things can be more complex in the way the condition is treated. Surgical clipping can be used, in which case the surgeon removes part of the skull in order to reach the aneurysm. A tiny metal clip is then placed at the neck of the aneurysm to stop the blood flow. This is okay for the patient, as the brain and body will detect the difference in blood flow and direct the blood through other vessels. The less invasive route is much like that of the tube graft. A catheter is run up through a major artery of the patient to the aneurysm. A soft platinum wire is fed through the catheter. The wire then coils up inside the aneurysm and disrupts the blood flow, making the aneurysm clot. The clotting of the blood then closes off the aneurysm from the rest of the artery. Now that we know the whole situation that may develop from an aneurysm, what causes them? There are many things that can lead to the weakening of a vessel wall, which then may lead to an aneurysm. One of the major causes of aneurysms is that of smoking. Smoking contributes highly to atherosclerosis, the accumulation of fatty deposits on the artery wall, and hypertension. Other things such as trauma to the vessel because of an accident or genetic disorders can lead to the development of aneurysms. Marfan syndrome, and simply a gene that plays a key role in cardiovascular development, can lead to the weakening of an aortic vessel. I hope that a little education on occurrences and background on aneurysms will help you as the audience to avoid the causes and understand which steps can be taken towards treatment in the case of an aneurysm. There are almost 500,000 deaths worldwide each year caused by brain aneurysms, and half the victims are younger than 50. It is important that people understand what an aneurysm is and how it is caused. This gives the population background so that they may live their lives in a more healthy fashion. The procedure taken to repair something like this, whether it is minimally or greatly invasive, is a hard process to go through and will take time for the patient to heal and get back to normal lifestyle. Even with the treatment, there is the possibility of another aneurysm occurring or a complication with the one that has already been treated. I hope that with the information provided, people will be able to avoid or be better prepared for an aneurysm that may arise in a friend or family member or even themselves. If an aneurysm ever becomes part of your reality, think on the steps that need to be taken to diagnose and treat it, and how you may avoid another scare.